Being a bi-provincial city comes with its fair share of challenges. One of the biggest problems, providing you equal and adequate coverage no matter what side of the border you live on. But healthcare in Canada is far from universal. Each province abides by its own guidelines, and for one local resident, that almost cost him his life.
I went to the hospital, I had stomach pains, and so I went to the hospital emergency here, and they did some CAT scans and x-rays, and after 4 or 5 hours they determined that I had a blocked and twisted bowel. So then they decided I had to go to Edmonton to have the surgery done on it.
April 20th, 2011, a day Erwin Elliott will never forget. After hours of testing in the Lloydminster Hospital, he makes the 250-kilometer trek to Edmonton by ambulance for life-saving emergency surgery.
So when they sent me up by ambulance, I guess they never sent the x-rays or CAT scans up there. So then they had to redo them all up there.
To complete the surgery safely, it should finish in less than 5 hours. But with all the retesting for Erwin, it takes almost 24. He's put through this stress because all his test records are in Saskatchewan's Lloydminster Hospital and can't be transferred across the provincial border.
Basically, the surgeon up there said I'm very, very lucky to be alive.
Erwin voices his concerns to Prairie North, sharing his experience in a letter to the healthcare provider.
This time could have been shortened by at least 10 hours if the x-rays and CAT scan charts would have been sent with me to Edmonton. Being blocked that long should have resulted in death. I'm very disappointed in the way this was handled and hope it never happens again.
Erwin does receive a response from Prairie North saying it has been determined that an error was made in regards to the hospital physician not being aware of our protocol for transferring reports. In hospitals connected with the same technology, they can be sent electronically. In your case, this was not possible. Please accept our apology. And it's a sticky situation transferring records from one province to another.
Well, there are complications.
Dr. Bruce Murray works across the region, looking after physician and medical access related issues.
There's an Alberta Health Information System and a Saskatchewan Health Information System, and they sometimes have trouble communicating with one another.
The trouble with having information flow freely.
Not only does the information have to flow, but it also has to be in a confidential manner so that only those people who need or require access to healthcare information actually receive it.
And while the health region says it is making strides to make that communication happen, service is still far from seamless.
These types of border issues, where they're mild irritants across Canada, are day-to-day issues here in Lloydminster.
But it's not nearly as seamless sort of a situation as it should be.
Provincial officials say steps are being taken to tackle the problem.
For some time now, right across Canada, we've been talking about establishment of a fully transferable electronic medical record, one that would be accessible to a doctor regardless of which medical facility they're in.
We have fiber optic cable in this clinic. We're in Saskatchewan. It's Alberta fiber optic cable. Who talks about seamless? It happens.
For longtime physician Dr. Raf Saeed, since seamless record transfer didn't come to him, he took matters into his own hands.
The bureaucrat working for Prairie North said can be done. The IT guy said no, requires a flick of a switch.
Dr. Saeed's Saskatchewan clinic is able to exchange information with Alberta hospitals and healthcare centres and has been tapped into that system for over 4 years. All he did was contact Alberta officials, saying 60% of his patients were from Alberta. Within 6 months' time, Alberta's Netcare system, which is used in all hospitals, clinics and health centres across that province, was up and running, despite his practice being on the Saskatchewan side of the border.
When I can send information to India and South Africa, MRIs and stuff, hello, What does it take to send it across to Edmonton?
There's been a lot of work done on that. It's been worked on at a legislative level, and we're very hopeful that over the next few months to next year, we will have access to both systems.
In order for doctors to practice on both sides of the border, they must have a separate license in each province.
What's the goal of medical treatment? Is it to treat symptoms or
to get you better?
Right.
So that
The College of Physicians and Surgeons is responsible for licensing practitioners, and 2 weeks ago, for the first time, head honchos from both organizations in Saskatchewan and Alberta gathered together in the border city.
I learned that having a border that cuts through the town and that separates the side with the hospital from sides with, for example, nursing homes and long-term care facilities is a challenge. Especially since we've got physicians who need to be licensed on both sides of the border.
According to Prairie North, all doctors in Lloydminster must be able to practice in the Lloyd Hospital, but aren't obligated to have an Alberta license as well.
A person whose doctor is only licensed in Saskatchewan may not be able to go over and see their patient in the Dr. Cook's nursing home or the Points West or the Hearthstone or Hemstock or make a house call because they do not have Alberta licensure.
Something Dr. Saeed says can take a toll on patients.
If you're comfortable with your physician and you have faith in your physician and that physician is unable to come and care for you, it has a detrimental effect on the psyche of the individual.
And at the end of the day, there's still more questions than answers. Most records aren't transferable across borders. Each province still has different standards, and doctors still need special licensing depending on where they practice.
I think there's ways that we can make the provision of medical care to the Lloydminster citizens as seamless as possible, and that's our goal, and hopefully the goal of all of us.
The border city battles many bi-provincial problems, and having two healthcare providers doesn't make finding solutions any easier. Coming up after the break, can a gathering of everyone involved with Lloydminster's healthcare actually help get some answers? Stay tuned, that's next.